Thank you very much, Mr. Chairman, and let me thank you for your leadership on this. And I want colleagues to know that once again, Chairman Hatch is stepping up and providing real leadership on one of the great challenges of our time. This is in line with his work on CHIP and a whole host of other important health issues. And I want you to know, Mr. Chairman, I'm very much looking forward to working with you on this. 10 months ago, the Finance Committee came together to discuss what I consider to be one of the premier challenges of our time, addressing the chronic illnesses that dominate America's flagship health program, Medicare. Chronic illnesses, heart disease, diabetes, and cancer, among others, now account for almost 93% of Medicare spending. This was not the case when Medicare began in 1965. Back when Medicare began, its primary purpose was to help individuals with catastrophic health events that put them in the hospital. That picture is now turned upside down. It has been hard to get precise numbers from that particular era, but we do know this much. In 1970, according to the Centers for Medicare and Medicaid Services, 64% of total Medicare spending was devoted to care provided to patients in the hospital. By 2010, that number had dropped to 26%. So we are talking about a program that has been a lifeline for millions of older people, and a program that has changed very dramatically since the program was enacted in 1965. Today, the vast majority of Medicare dollars are spent caring for patients living with multiple persistent chronic health conditions that require a variety of services. It's a good thing that care is being provided outside the hospital. What we have to recognize is too often this care is poorly coordinated and needlessly costly. With a trend this clear, it is time for both parties to tackle this issue head on. And we are fortunate, colleagues, to have Chairman Hatch make this a priority for the Senate Finance Committee. I also want to point out that last month, the Congress took an important step by ending the broken Sustainable Growth Rate formula. Throwing that program, what was called SGR, in the junk bin of history accomplished two major things. First, it engraved in stone the principle of rewarding medical care that provides quality over quantity. And second, it cleared the legislative logjam that has blocked the Congress from taking a close look at how Medicare can be tuned to work better for patients and encourage providers to improve the care that they deliver. So it is going to be essential to build on that progress, to build on the progress by getting rid of this outdated reimbursement formula, this formula that was common sense defying. We now need to build off the progress of eliminating that to address the challenge of treating chronic illness. Since our hearing last July, I've held a number of roundtables around my state to hear what the committee can do to make Medicare work better when it comes to chronic illness. I've received a number of valuable comments along the way, and I intend to work closely with Chairman Hatch, Senator Isaacson, Senator Warner, to offer what, in my view, are a host of key principles that ought to be part of any attempt to more effectively care for patients with multiple chronic illness. And let me make a kind of start at that this morning. First, Medicare needs to encourage teams of providers to coordinate care for their patients with chronic conditions. Those with multiple chronic illnesses often have a half dozen doctors, but those doctors may not communicate to provide the most efficient care. This is a situation that ought to be turned on its head in favor of a holistic approach that encourages providers to work together to make our patients healthy. Working with multiple doctors is especially challenging for those who live in rural communities. Treating multiple chronic conditions is hard to do anywhere, but it's even more difficult when doctors and specialists are 80 miles apart. Families that face chronic health issues shouldn't have to add a whistle-stop tour of doctors' offices to their challenges. Second, the Congress needs to make life easier for providers who want to coordinate care, whether that's more information about patients, improved access to innovative technologies, or other measures that promote flexibility in our health system. At the same time, accountability is critical to ensure providers are successfully treating patients while also providing savings from coordinating care. As Chairman Hatch noted, I have been passionate about this issue for some time, but now with the input and efforts of the whole Finance Committee, I believe that we can craft a bipartisan solution that really gets at the heart of the challenges posed by chronic illness. So I'm very pleased to be teaming up with Chairman Hatch on a plan that begins with this working group and ends with legislation being passed out of this committee. The working group will develop policy options to address how Medicare can work better for Americans with chronic illness, and we are very lucky to have that effort co-chaired by Senator Isaacson and Senator Warner. They have been dogged in this issue. I commend them for it. And I also want to take note that Senator Bennett and others who have demonstrated an eagerness to dig into this issue and come up with real meaningful reforms. One last point, if I might, Mr. Chairman. We've gotten a lot of valuable feedback from patients and providers, but this morning I want to take special note of Stephanie Dempsey of Georgia, who was a witness at our hearing last July. Ms. Dempsey was dealing with heart disease, lupus, arthritis, and a seizure disorder, and I am sorry to say that she passed away in December due to these conditions. I talked with Ms. Dempsey's mother this morning, Ms. Nancy Carter, also of Georgia, to convey the committee's sympathies with the family, to say how much we admired Ms. Dempsey's courage, her passion, and her intelligence. I'll close by saying I believe Ms. Dempsey will be an inspiration to all of us, and we should remember what she said at our hearing. She said, and I quote, "I'm confident that you will not forget me and countless other people when you develop policies that will help all of us. Our goals are all the same, to live long, healthy, and productive lives." And I just wanted to use this morning, because I know Mrs. Carter and family are paying attention to this, to let them know that we are dedicating our efforts to Stephanie Dempsey, who spoke so eloquently for millions who have these chronic illnesses. And we are going to work on this in a bipartisan fashion until we have the reforms necessary to help the millions of patients who needlessly suffer in this fashion. Thank you very much, Mr. Chairman.